Today's topic is diabetes, a very scary topic. Why do I say scary? Because patients जब मेरे पास आते हैं डॉक्टर डायबिटीज़ डायग्नोस हुआ है तो वो काफ़ी स्केर्ड होते हैं. मैं आपको बताती हूँ डायबिटीज़ के बारे में. आई एम डॉक्टर हेमा MD in homeopathy, having 15 years of clinical experience in teaching and treating patients. Today topic diabetes mellitus is of two types, type 1 and type 2. Type 1 is called juvenile diabetes. Juvenile diabetes, the name says, as it is more seen in the childhood. And type 2 diabetes is the most common, which is there in the 90% of the population. डायबिटीज़, जब डायबिटीज़ बोलते हैं तो वो बोलते हैं मुझे शुगर की बीमारी हो गई है. शुगर, सो डायबिटीज़ इज़ वेरी clearly related to sugar metabolism in our body. Now we will understand which all major organs are involved in diabetes mellitus. So first, the major organ is pancreas. Pancreas has cells which are called as islets of Langerhans. Islets of Langerhans, there are two types. There are beta cells which are in the center of the islets of Langerhans and the alpha cells which are on the periphery of the islets. And the beta cells have the main hormone in it that secretes insulin, and the peripheral cell secretes glucagon. So here we understand there are two hormones involved in the mechanism of sugar, that is diabetes, that is insulin and glucagon. Insulin helps to decrease the sugar levels in the blood and glucagon helps to increase the sugar level in the blood. Now we will understand why this mechanism is disturbed. Now, as we rightly said that there is lot of correlation with the mind, as in my all videos I have shown you the relation between the medicine part and the homeopathy part. So the difference in the case taking approach I will let you know. इसमें क्या करते हैं कि जो हिस्ट्री लेते हैं उसमें हम माइंड में देखते हैं. सो बेसिकली जैसे हमने ये कॉमन सिम्टम समझा कि इंसुलिन के मैकेनिज्म के वजह से शुगर मेटाबॉलिज्म डिस्टर्ब होता है, लेकिन इंसुलिन क्यों डिस्टर्ब होता है? माय क्वेश्चन इज व्हाई दिस इंसुलिन इज गेटिंग डिस्टर्ब. देयर आर मेनी पीपल हु ईट लॉट ऑफ स्वीट्स, लॉट ऑफ आइसक्रीम्स, लॉट ऑफ कैंडीज, लॉट ऑफ शुगर, yet there is no problem. But people, even if they don't eat much of sugar, they suffer with diabetes. Why? So we will understand today why this happens. So today again I'll make you understand that the maximum people who have anxiety. So basically diabetes is something which is anxiety. Why? Because there is accumulation of glucose in the body. Sugar बढ़ जाता है बॉडी के अंदर. कोई भी चीज़ बढ़ता है वो एक डर से बढ़ता है. डर एंजाइटी से आता है. एंजाइटी में एक हार्मोन रिलीज होता है जिसका नाम है सेरोटोनिन. जब सेरोटोनिन डिस्टर्ब होता है तो वो दूसरे हार्मोन्स को डिस्टर्ब करता है. और जैसे फैमिली हिस्ट्री में अगर किसी को डायबिटीज़ है तो उसका पैनक्रियास पहले से वीक है. सो दैट मीन्स द पर्सन इज गोइंग टू गेट diabetes. So as I always tell you that homeopathy treats the root cause, we are trying to find the root cause of the anxiety of a person. Normally these people are anxious from the innate genetics. मतलब बचपन से ही ऐसा रहता है कि ये बच्चा थोड़ा सा anxious ही है. Anxiety में what people start doing, anxiety, fear, people start accumulating things. The more accumulation in the body, the more fear in the body. So diabetic people have more anxiety and they have more overthinking. So they think a lot. They try to accumulate things. Same way the body does in diabetes. They try to accumulate fat, so they are obese. So everything is in the form of accumulation. So what symptoms they show in diabetes? There are symptoms which are polyphagia, polydipsia, polyuria and glucosuria. So what happens with this? Poly means a lot, phagia means hunger, so they have a lot of hunger. Polydipsia means they have lot of thirst. Polyuria means they have lot of urine. And glucosuria is there is a glucose in the urine. So why this is happening? Why these things are in lot? Because the metabolism of the body is disturbed. इधर ब्रेन भी इन्वॉल्व होता है. नाउ thermoregulatory system, when you talk about the hunger increasing, the thirst increasing, definitely there is a problem in the thermoregulatory system of the body. The thermoregulatory system is in the hypothalamus, that is the hypothalamus in the brain, and that gets disturbed. At the same time, all the organs gets disturbed, because this mechanism causes the cells to get into atrophy means there is no energy in the cells to work. So whatever body tries to defense is they create more and more beta cells are the cells which produce insulin. Because there is so much sugar in the blood, our body's defense is to create more and more beta cells. But this is going to be a temporary phase. Beta cells will be produced, but at a particular time they get tired, exhausted, and get back to their normal. So to make the changes for the diabetic patients, what we should do is treat the cause. And homeopathy very rightly says treat the roots. We have to find out the roots, why this person has become so anxious and why the body cells are creating disturbances. Now there are two more types of diabetes, that is called gestational diabetes. Gestational diabetes is in the pregnancy. Pregnant females in the third trimester normally suffer from this gestational diabetes, where because of the pregnancy hormones, the insulin hormone get disturbed. Many times it gets corrected after the birth of the baby, many times it requires treatment. And the one more that I talked about was type 1. It is called juvenile diabetes. Juvenile diabetes is more destructive because it is autoimmune, where the T cells, the immune, the main mechanism, the immune system attacks the self, the cells of the self, the same of the body, which is supposed to protect and save. So there is a problem with the genetics. So if we try to understand the history of the patient from the pregnancy, that how the child was born, mother was anxious during the 9 months of pregnancy, so we find the root. So this is how the history approaches there in homeopathy. So this is the correlation of homeopathy with diabetes, and at the same time all the investigations can be done regularly, and you will see fantastic results that your fasting blood sugar, the after lunch blood sugar, the urine sugar, everything is getting into normal. And even have seen the results that after the treatment and everything is fine, patients can eat lot of sweets, still the body is able to maintain the mechanism of insulin. So today this is this much. Thank you so much. You can like, subscribe for my upcoming videos. Thank you so much.